Hi, everyone. I'm the director for our New Zealand registered not-for-profit Common Knowledge Trust, and we hold two things. One is a concept that hundreds and fathers of mothers developed with me in the early 1970s in the US, which is a concept. A concept is an idea, and the idea is put into words, and then it's followed by actions. So the concept is simple. When you're pregnant, it's normal and natural to self-learn birth and birth coaching skills and then use those skills to work through the activity of doing your baby. Now, when this concept developed in the United States in the early 70s, from the 60s to the mid 70s, the very first childbirth preparation classes were taught, and they were entirely skills based. They were Lamaze and the Bradley method. There was a very high societal expectation that us as modern families would take the first childbirth preparation classes. We went for 6 weeks, 3 hours at a time. We learned breathing and relaxation skills, and we went home and practiced them. And then we went into the hospital with the evidence-based practice of the day. There were no midwives, very few home births. We went in with all of the assessments, monitoring procedures, and we used the skills the best we could. My generation of people felt empowered by birth. We didn't always like the assessments, the monitoring procedures. We didn't find the skills adaptable, adjustable, or sustainable, but they gave us something to do. That's what skills are. You do them, you use them, you apply them. That's what skills are. Now, I gave birth first in 1970. Sadly, the, the idea behind those skills and the words were that low-risk women should use those skills with the goal of having a natural birth, pain-free labor with no medical care. And so that's what everybody was looking to see whether those skills could achieve. They missed what they actually did achieve, which was they hugely reduced or prevented the suffering that women have always experienced globally around childbirth because women do not have skills. We don't have a historical or multicultural heritage of using skills to birth our babies. And that's because there's no way to know what your birth's going to be like. And so throughout our humanity, we had skills in place to try to prevent problems about what to eat, what to wear, what not to do, and after the birth of how to take care and safeguard our newborn and our mothers right after the birth. But the birth itself, 100% of women labored. We didn't have skills, so women suffered. Didn't mean there was a problem, and they didn't cope because you don't know how long your birth's going to be. It happens to you. So when the first childbirth preparation classes came along, and they were entirely skills-based, everybody was taking the classes, whether they were low risk or high risk. And we all used the skills the best we could. No, they didn't adapt well. They weren't adjustable. You couldn't sustain breathing. There's Lamaze, and the in the nose, out the mouth could be very relaxing. Drop your jaw, or women can scream, ah, or moan, ah, right? So when birthing better skills began to develop, we nitpicked, and that's the second part. So we had a concept, and that concept included any skills-based method. And back in the 1970s, it was Lamaze, Bradley, and Grantley Dick Reed. Birthing better skills didn't get into the media until 2000. But I carried them with me. So we had this concept that when you're pregnant, it's normal and natural to self-learn some birth and birth coaching skills, and then use those skills to work through the activity of birthing your baby. And back then, there was a 4.5% cesarean rate, so we were still all laboring. And when we developed the birthing better skills, even though we didn't get them into the public arena until 2000, the fact is that the families who developed these skills developed them so that they could cope better with childbirth. We could cope and manage better. We filled in the gaps that Lamaze and Bradley in New Zealand, where our trust is located, they still had because the skills were not adaptable. And this is true of any subject that begins to develop skills around it. There always room for evolution of those skills. So our trust holds the concept that when you're pregnant, just learn some skills and use them to birth your baby, no matter where you birth or who's present or your circumstances or beliefs, your choices or lack of choices, the change of choices, or your circumstances. Use skills. Birth is going to happen to you, but you have to do it. Women are the only ones doing the birth, no matter what's happening. So primarily, we need to learn skills as women so that we can work through the activity of birthing our baby. So we can come through that activity having some sense of competency, which inspires us to feel competent as we parent. So there's in the 1980s, when I gave birth last, the skills-based trend had pretty much disappeared. If you talk to somebody in the 80s when they took childbirth education classes instead of preparation classes, then people were learning the pros and cons of medical assessments, monitoring procedures. They were now being called interventions, with the implication they were imposed on women and unnecessary. And very few skills were taught, maybe a little bit of breathing, and that was it. And so people stopped using them. By the 90s, honestly, people would say to me, I'm using skills. I'm investigating the pros and cons of interventions, and I'm writing a birth plan. That's skills. Yeah, it is. And then, since then, it has been harder and harder and harder to explain to people what childbirth skills are. And partly that's due because the message that has come from the 80s is that cows and cats aren't taught to be skilled to birth. Women don't need to be. We've always done it as women, so therefore we should just trust birth. And famous authors said just leave women alone. Don't tell them what to do. They know how to birth. And where are we now? Honestly, where are we now? So when COVID came, I decided to come out of retirement and start to talk more about what we do in our Trust Common Knowledge and what we do with Birthing Better. We've been selling online for 20 years. Then it was a VHS, a book, and a cassette. Now it's online classes, and it's all skills-based. You can get lots of information elsewhere. You can make lots of choices. And there are now other skills-based methods. Hypnobirthing, calm birth, birthing within. There may be more that I don't know because I haven't really kept up with that part of it. I just keep up with passing on this concept into a really mentally hostile environment around childbirth, a very resistant environment that believes that, on the one hand, that women are lazy and don't want to do anything for themselves when they're pregnant. All they want to do is follow their doctor's orders or rely on their midwives and be told, your job is to make choices, but we're really lazy. We make a birth plan and we spend lots of time trying to make choices, but really when it comes down to it, we're just sort of lazy as women. So that's a large part of the message I hear. And on the other side, I also hear, you can't really expect men and women to use skills to create space for their baby, can you? So on the one hand, women are lazy. On the other hand, they shouldn't be skilled. This is women talking about it, not men. Right? So we have a problem in childbirth. Skills were actually dismissed, and they still are. I can't tell you how many people say to me, you're denigrating women by saying that we have to be skilled to birth our baby. And so our trust has to constantly come up with analogies because birth is so unique in our humanity. And it's natural, normal, and physiological. And what else is? What are the other things in our life that are also natural, normal, and physiological. And the two biggest ones are sex and hunger. And so when we think about why we should be skilled in childbirth, we have to think about why we should be skilled to have sex, why we should be skilled to cook or to know what's safe to eat. And so that's a slight comparison. But if we go deeper into that, we have a bigger comparison because how many times are you going to get pregnant and give birth in your life? I mean, prior to contraception, many women were having 7 to 15 babies. But even if I've worked with people having 20. So let's say you're going to get pregnant or have a baby 20 times in your life. Let's say you could only have sex 20 times. But now, realistically, it's going to be 1, 2, maybe 4. So let's say that's all you could do, 4 times to have sex or 4 times to eat. Would you just trust people who said, don't worry about it, you're going to know what to do? You'll know how to cook. Your kids are going to know what's safe to put in their mouth. Don't worry about it. It's a nothing burger. It's instinctive, it's natural, it's normal, it's physiological. Humans have always had sex. We've always eaten. We know how to do those things. We would laugh. Would laugh. So if there is so much information about sex, whether it's pornography or tantric yoga or Taoism, there's so much information about it. Sex toys, you name it. If there are so many cookbooks, so many plant identification guides to make certain that we don't consume poisonous things, there's so many of those around now. Why have women been so resistant to believe that giving birth innately should be a skilled activity? And partly it's because we have different cultural norms. Sex is universal, eating is universal, but thank goodness we don't all cook the same. And as for sex, yes, it's very, very different in different cultures. But childbirth is the same. Now we're going to, at the moment, put cesareans aside. But don't be fooled about that because Birthing Better families had cesareans. And we loved preparing our body for birth because we were pregnant so infrequently. We wanted to be more intimate. We wanted to feel more skilled. We wanted to feel more competent. We wanted to work with our partner more. We enjoyed it. We thrived on it. It was one of the great pleasures in life is to integrate our pregnancy into our capacity as humans to be skilled. And then we use the skills on the way to the hospital while being prepped and in surgery. We did the same thing. We are going to give birth to our baby. It's an activity. So we learned the skills and then we use the skills. So we don't distinguish as Birthing Better or Common Knowledge Trust how anybody has their baby. It's your baby's birth. It's an activity you're going to do, and we encourage you to become skilled. We learned that preparing our body for birth starts at 24 weeks, and we started to develop the body skills in the 80s as the cesarean rate was increasing due to the fact that the type of cesarean had changed from classical to a bikini cut. And now we were awake and our husbands could be with us. And we could reduce and prevent the risks that we couldn't reduce and prevent prior to that. And women were more likely to say, if my breech baby is at risk from having a trapped head and asphyxiating, I'd much rather have a safe cesarean for my baby. Ditto for my twins. So women demanded that risks were reduced and prevented. That doesn't take away from the fact that you still have to do the activity of birthing your baby and should do it with skills. So how do we look at skills? What are the components of skills that actually make us a skilled person to do this universal activity that 100% of pregnant women are going to have to do one way or another? So you take a look at just being here, our human beingness. We breathe all the time. We breathe in, we breathe out. And birth is often connected to pain. How do you breathe when you feel pain? Ah, ah, ah. Yep, that's how women in labor do. But with skills and knowing how to choose, the determination to cope, then women are more likely to, oh, that's right. And then it begins to sound like sex, right? So breathing, it's very important. Learning good breathing skills that adapt, adjust, and sustainable. What about our body? Is our body present when we're doing the activity of birthing our baby? Well, it sure is, whether we're having a cesarean or labor. And sure is, we're in our body. And what's happening if we labor? We have a big object in us that has to open up a cervix and come down through a bony tube, our pelvis, and then come down through our vagina and open our vagina up. That's a body. We learn to prepare our body. That's a skill. You learn around 24 weeks to do the hip lift, the sacral maneuver, the sit bone spread. At 32 weeks, you spend 5 minutes a day preparing deep inside the vagina. And then you learn about positions so that you stay open for your baby. And you learn about what a progressive labor sounds like and looks like, and what a non-progressive labor looks and sounds like. So then you can make choices about what position you're in, because your position impacts this object. You can make decisions to make certain that you are as open as possible so that you can help this object move through your body. You can make decisions about not compressing the baby's space, like counter pressure on the sacrum for back labor, instead being able to move your sacrum, or instead of sitting in a semi-recumbent position, which is sitting on your sacrum with your knees bent and feet down, which compresses the space the baby needs to create to move under the pubic bone, or bending over so that the baby isn't well aligned to the inlet. These things we can know, we can feel. Our partners as birth coaches can see and hear them. And they're more likely to see and hear them sooner because we're in the experience doing our best to apply skills and we miss it. Someone from the outside can hear immediately whether the contraction has a peak. And we now know from the work that fathers and mothers did in developing the skills that there are 5 phases to each contraction, which meant that we could adapt and adjust our skills to any of those 5 phases, even if we lost it, if there was an intense, painful peak. And if we didn't hear the peak, if there wasn't a and then coming down, if there was more of a then you could hear and see that right away. And then you could discuss, is it that you're bent in a certain way? Is there compression? Are you tense inside you don't know? Are you in a position the baby doesn't like? And then that goes back to women lazy and don't want to know anything. To women can't possibly do this stuff. We can't possibly do that in birth. Yet isn't it curious that after the birth, we're expected to do bloody everything? So somehow, we as women have said to one another, you're lazy and we don't want you to follow doctors and midwives' orders because it's your birth. So choose what kind of birth you want. But you can't possibly learn skills to work through this activity you have to do. But once the baby is born, we expect you to have those skills. And trust me, there will be no professionals around you that you're going to follow their orders. Because somehow pregnancy and childbirth have been co-opted. And they've been co-opted, yes, by the medical profession, surely, because even though maybe 15% of women have issues, how do you know? Unless you do assessments, monitoring procedures. And birth is always normal, natural, and physiological. It always has been prior to cesareans. And when I gave birth in 1970, 95% of us labored. And how did that go? Well, some of us had great births. A large part of us found it challenging, and a good percent of us suffered. Some of us had short births, and we could suffer in a short birth because they were so bloody intense. Others of us labored for days because there's no way to know what your birth's going to be like. And there was very little that could be done. You just kept going. Most of us had good outcomes. Risks were considered to be absolutely normal, natural, and physiological and tolerated. We knew there were lots of risks. And those risks, few of those risks actually became problems. And few of those problems became tragedy. Most resolved themselves or could be resolved. But there were tragedies. And tragedies are not just the death of the mother and the baby. If a woman rips through her rectum, that's a tragedy. If she has postpartum hemorrhage, that's a tragedy. There are lots of tragedies. There are lots of problems. So we have been told by the medical profession, birth is only safe after it's over with. And that's true. A healthy baby and a healthy mom is only known after it's all over and everybody's recovered, and for the 6 weeks afterwards. The natural birth movement says birth is safe unless proven wrong. They're absolutely right about that. Absolutely right. There are lots of risks. Few risks become problems. Most problems resolve themselves or get fixed. Very few tragedies. So they're both accurate. So, but what about us, right? It comes back to us. Everybody sees it from outside us, but we have to do it. And that's why we should become skilled. And yes, from us, our viewpoint is a trust. And the Birthing Better families who developed Birthing Better skills, part of it was coping so we didn't suffer. So we had skills around breathing, communication to ourselves and to our partner, and touch, so we could use touch effectively. And we had other skills like the 5 phases of contraction, the progression of labor, the positions, and all that stuff. And then we worked on creating more space for the baby so that our babies could come out more easily, which then causes us to have more progressive labors, which causes us to have contractions that get closer together, longer and stronger and more intense, which we don't always like. So we have to learn to apply skills when we're feeling intense pain without any understanding of when this is going to end. So we develop skills like the hip lift. We develop skills like the internal work. We develop skills like the sacral maneuver or Kate's cat. We develop skills like making certain that every position you're in creates a bell-shaped curve progressive contraction. We created these because as grown-ups, as adults, as capable men and women, we could learn skills to do this infrequent, one-off, can't be replayed, dramatic, dynamic, life-transforming activity called giving birth. Of course, we are going to follow our doctor's suggestions. They're trained to safeguard the health and well-being of our baby. So are midwives, who see themselves often as non-medical and yet follow all of the same medical protocols. So they give a mixed message. They trust birth. Why are they going to school? Why do they listen to heartbeats? Why do they do anything if it's just so natural? Because you don't know. We don't know. So we do assessments. We do monitoring. Why does the natural birth movement say to women, if you're having a niggling labor, stimulate your nipples, have sex, drink castor oil? Those are all interventions. And we don't have any skills really about niggling labor until Birthing Better families figured out. They got sick and tired of being tired when they went into labor. So they figured out a great skill, but you have to use it. And that skill is just ask a simple question. What do you want to do now? If your labor is not getting longer, stronger, more intense in an hour or two, you're not in active labor. So, what are you going to spend your time doing? You got to do something. You got to get on with life. And too many women went into labor tired when they kept trying to get their labor going. Instead, what do you want to do now? Do you want to eat? You want to have sex? You want to go to the movie? You want to take a nap? You want to take a shower, a bath? You want a massage? And keep on asking that question until labor starts to progress. And because if you've done the internal work, that's a skill, then you can check yourself. That's a skill. If there are changes in there and you know what those changes are, why should you not be able to do those things? For goodness sakes, we go and fish out tampons. So we as women have got to get our heads wrapped around this. This is an activity we're going to do. It should be highly skilled. We should want to elevate it to our Olympic event that we can never practice to beforehand, but we have to do. And it can hurt. And when we don't know when it's going to end, we should want that. That's what our trust has been doing since the 90s when it was set up, and I put all of this into a charitable trust. And what I did for 25 years prior to that. And now I'm out here speaking out again, right? But it's up to you. You have to want your generation and your children's generation to think it's perfectly normal and natural to self-learn some birth and birth coaching skills and then use those skills to birth your baby. Are all skills-based methods the same? No. Certainly, hypnobirthing tremendously focuses on putting yourself, self-induced hypnotic state through meditation, breathing, relaxation. Lamaze is breathing relaxation. It's one type of breathing, one type of relaxation, ragdoll. Bradley's a different type. Calm birth's a different one. Birthing within, slightly different, variations on the theme. Birthing better is the only one developed by fathers and mothers. And nitpicking every single thing that we wanted to fill with a skill that we didn't feel we had. It's certainly the only one that focuses on creating space for your baby, and certainly the only one that gives you skills to use if you feel that your labor isn't moving along. So skills are just vitally essential. They're just vitally essential. And certainly in my lifetime, I would like to see more people passing this on. Now, if you're a doula or a midwife or a childbirth educator, a chiropractor, an obstetrician, a labor and delivery nurse listening to this is what you can do to help spread this message. Tell your clients that it's normal and natural when they're pregnant to self-learn some birth and birth coaching skills. And if you feel like it, make a handout of all the different skills-based methods, not the information ones. What to do when you're expecting. That's information, right? That's the other part of it, making choices. Choices are what you want, what you don't want, what you'd like, what you don't like. Skills are what you do, what you use, how you do the activity. So just give them a handout of the different skills-based methods. Don't have a judgment about it. If you're going to be at a birth, mark that in your notes. If you're going to be at a birth and you see them through continuity of care, through pregnancy and at the birth, then tell them to start at 24 weeks and notate every time you see them what skills they've learned, just as you're notating what choices they're making or what lab results they're having. And then at a birth, if their choices unfold, terrific. If they don't, include them in decision making. If they look like they're coping and working well, praise them for the skills they're using. It's great working with skilled families. And if they look overwhelmed and stressed, go back to their notes, see what they've learned, tell them to use it. You may find some saying, well, I said I did, but I didn't learn them. Okay, well, that you have what you have. And always remind families, if you're a care provider, it is what it is. So, for example, I talked to a woman the other day. She had learned birthing better skills. She was planning to birth in a birth center. Her plans changed because she went over her due date, and she was over 42 weeks, and she was encouraged to be induced. She was okay about that. And then she was told that inductions usually don't kick in for 24 to 48 hours. And so that's what she had in her mindset. She's following doctor's orders. And her labor kicked in 2 hours later. And you know what she did? She didn't use her skills because it wasn't what she imagined it to be like. And she didn't start to use her skills until after she had an epidural, which is fine. And then she began to use her skills more and more and more and more as her labor progressed. And then she really highlighted her skill use when she figured out how best to stay open during the second stage and birth her baby. And she knows that what she did was, when her labor kicked in, is to just go into, there's nothing I can do about it. Yes, it is. It's happening. Right? So use your skills. It is what it is. If you want a home birth and you have a home birth, use your skills. If you want to have a home birth and you end up in a hospital, use your skills. If you have a hospital birth and have a hospital birth and have very little assessments monitoring, use your skills. If you have a hospital birth and you're wired for sound in every hole, use your skills. If you want a hospital birth and you end up in the backseat of a car, use your skills. We as women are doing the activity of birthing our baby. And when we do it using our skills, we feel empowered. It's as simple as that. So get on board. Now, if you're a pregnant woman or an expectant father or a relative, purchase a skills-based method and start learning. If you're 42 weeks plus, learn something. Any skill is better than none. And if you're early in your pregnancy and you want to start now, by all means, start now. Spread out learning the skills. Increase them more. You'll integrate them into your life. You can't practice birth beforehand, but it's going to unfold. And when it unfolds, it is what it is. Whether you like it or not, whether it's what you wanted or not, it just is what it is. If you've had a traumatic birth, a lot of Birthing Better families learned the Birthing Better skills in between pregnancies so that they could go back and overlay the skills to what they might have done. They don't do it to guilt trip them. They do it to heal them. Because if you didn't know, and you didn't know you needed to know, and nobody told you to become skilled, you're not looking for skills. It's not your fault. Nobody has told you to become skilled. They've told you to make choices. No wonder there's so much disappointment going on. Babies rarely come to plan. But they always have to be born. And that is the difference between choices and skills. You may have got nothing you want, but you still have to do it. And it is what it is when it unfolds. So become skilled. That's what's going to leave you feeling empowered. And pass this on. Subscribe to our channel. Get involved in this. Ooh, that sounds cranky, doesn't it? Okay. See you later. Bye-bye.